that haven't published. Oh, should I start again or?
Sorry about that, Cheryl. Yes, if you wouldn't mind. Thank
Yeah.
you.
So hi, I'm Cheryl Stimpson. I'm one of the local support organisations under the Better Security and Better Care programme. So today we're just going to be looking at using the Data Security and Protection Toolkit for the first time. So the webinar will go through for those that haven't published before, or just need to register and things. We will look at the questions and we'll just sort of do a summary of what they involve. Next slide. So just for the technical issues, this is for care providers that have never published before. Attendees are all on mute and can't be seen. If you can use the Q&A function to ask questions, if you have a phone, if you tap the screen, you'll see the controls, choose more and then Q&A. Any questions that we can't answer, we'll come back to you if you can just add your email address in there. The webinar will last no longer than 1 hour and you'll get access to the recording and presentation, including all the links. So today we're going to do welcome and introductions. So I've already introduced myself. So I'm Cheryl, I don't know, Cyprus. Do you want to introduce yourself? I've got some colleagues on the call.
Yeah, hi everyone, I'm Cyrus. I'm from the Digital Care Hub and I'll just be supporting here.
Hello everyone, I'm Rihanna. I'm also from Digital Care Hub and I will be supporting by doing the Q&A. So yes, as Cheryl said, if you put your questions in the Q&A section and not the chat, then yeah, we'll get back to you.
And then we're just going to be looking at how to register, looking at completing the toolkit, the things that you need to cover, how to publish the toolkit and support from the Better Security and Better Care programme. So just before we start, we're just going to do a poll just to see who we've got on the call and if you're aware of the DSPT, if you've used it before or anything else. So if you just want to click on the answers there, is your service already registered on the DSPT? If your organisation is already registered, have you started to complete the toolkit? And how would you describe your organisation? Have you got the feedback on there? Cyrus, have you got the results through? Okay, so I can see that, there's 59% of them that have already registered. For the others that haven't, or you're not sure, we can go through how to look at that. And I can see some of you have started to work on it already. So we're just going to start by playing a short video that will just explain the benefits of completing your toolkit.
Better security, better care with the Data Security and Protection Toolkit. As a care provider, you store and share important and often sensitive information. This includes data about the people you support, their family and carers, through to staff, partners and funders. To store and share that information, whether it is on paper or digitally, all care providers must have systems in place that reduce the risk of cyber attacks and information breaches. If you don't, your business and reputation could be at risk. You could be breaking data protection law. The Data Security and Protection Toolkit, or DSPT, is an online self-assessment tool. You can use the toolkit to check your data and cybersecurity policies, procedures and practices, and demonstrate that you have good systems in place. This can reduce the risk of a data breach and the risk of a fine if a breach occurs, as you will be able to show the Information Commissioner's Office the steps you are taking to reduce and manage risks. All adult social care providers in England, regardless of size, service type or ownership, should complete the DSPT at least once a year. When you have completed the toolkit, you can publish and share information about the standard you have reached. So what levels can you reach on the DSPT, and what do they mean? There are currently 3 levels on the DSPT. Approaching standards means you are meeting minimum legal standards. It's a temporary stepping stone to the next level, and you will need to produce an action plan to show what you will do to get 2 standards met. Approaching standards also enables you to get NHSmail, an accredited secure email system, which helps you to share confidential information with local authority, NHS, and other colleagues. Standards met is the level you really need to reach. It demonstrates that you are going above basic legal requirements, and it helps you to take some proportionate measures to protect you from cyber criminals. It will help you to reassure people who use your services, their families, and your staff that you are managing their information safely. It will also enable you to answer the Care Quality Commission's questions about managing data. And if you are accessing NHS patient data or delivering services under an NHS contract, you must have reached standards met. Local authorities are also increasingly asking for the DSPT in their contracts. Standards met opens up access to shared systems with other health organisations, including GPs, hospitals, and pharmacists. These systems can improve decisions you make about someone's care and save your staff time. Finally, standards exceeded indicates that you have gone beyond required standards. So, for example, you may have Cyber Essentials Plus in place. As a care provider, you should complete the DSPT at least once a year, but we know that not every care provider feels confident about using the toolkit. To support you, the NHS-funded Better Security, Better Care programme provides direct support, as well as useful guides, templates and a helpline to enable you to publish your DSPT and to protect the vital information you store and share. To find out more, visit www.digitalsocialcare.co.uk/better security, better care.
Thank you. So this is the toolkit journey. So once you've registered, you can then start to complete through some of the questions and things. There's 43 questions in total for the aim for standards met. If, however, for whatever reason you can't publish at standards met, you can publish at approaching standards. There's 26 mandatory questions here, but you will have to complete an action plan on how you're going to reach standards met. And you can only publish once for approaching standards. Once you've completed all the questions, they'll give you the options, which we'll look at later on how you can publish. And then it is an annual assessment, so you will need to review it every year. So as you mentioned, you're not alone. So there's 28 local support organisations that are part of the Better Security, Better Care programme. And you can log onto the website, and there's a lot of free templates, resources and help that can help you through that as well. So one of the things to share is that CQC are increasingly seeing this as important, and it is one of the recommendations to complete either the DSPT or equivalent. There'll be a link that can show you through. So it comes under the well-led for the framework. So now we're just going to look at how to register if people haven't already registered for the first time. So each organisation will have an ODS code. We'll go through, if you're not sure what your ODS code is, how to find that in a little while. You can also contact the help desk and they'll help you find that. We'll go through the different options of what ODS code to use. And then you then register through the portal. You'll receive an email link and be able to set up a password. The link does only last 24 hours, so you will need to have a look at that. So finding your ODS code and which ones to use. So, you know, organisations are all different. If you are a single site, so this might be you're a single care home, or you're a care home, home care agency, you might have many offices, but there'll be just one under one CQC registration. Then you need to start the toolkit using your V code. So you will have two codes, but if you use your V code for this one. Going forward. So the other thing you might be is a multi-site. So you might be a group of care homes that share the same policies and procedures. In this case, if you register for under the A code, you'll only need to complete one toolkit, and then you can register your V codes later. It's important to say every time that you do republish that you do also tick the sites that you want to complete for as well. And then you may be an organisation that has several branches and different types of services. So you might have care homes, home care agencies, and other different services too that might not be CQC registered. We recommend that you seek advice from the help desk on what would be the best code to use. And then we'll go through, or you can contact the local support organisation, they'll be able to help as well. So for the multi-site changes, you do need to make sure that you tick all the sites that you want to publish. I think some people or some organisations have published in the past and not tick the branches that they want to tick as well. So it's just more important just to sort of highlight that. And then when you do this as well, if you add your registered managers as viewers or auditors, they'll be able to see the toolkit as well. And I've already mentioned, just to mention again, that when you do revisit and republish, if you just ensure all sites are ticked. So finding your ODS code, you can go through the link there, or if you just search on the ODS portal, you can click through. If you're not sure or cannot find the code, there is the help desk number and email there. So where do you start? This is what the page will look like once you go to the portal. And you can either do the organisational search just to see if people have already registered on the DSPT portal already. If you can't find yourself, then you've got the register at the top right there. So registering and completing your DSPT, you'll be asked a series of questions. First of all, it'll ask what type of organisation you are. So you can see if you choose the social care, it will then tailor the questions that are relevant to your organisation. You can click through other questions, but this will ask about the different roles in your organisation. So do you know who your data protection lead is, if you've got cyber essentials and other things as well. If you're not sure, you can come back to that and answer it later, or just put NA. So setting up, once you've gone in, you'll be the administrator. So the administrator is the only one that can publish the toolkit and manage other users. So you can add colleagues in your organisation. You might just want them to view the toolkit. You can then do the members that will be able to edit, but they won't be able to publish. They can add evidence there as well. When you send this, again, the link only lasts for 24 hours, so you might want them just to ask, look in their junk mail or spam or something if they can't see the email. So support with registering, if you do need any support, there is the local support organisations, or for the ones that have got larger sites, then you've got the National Help Desk team that are there to support as well. There's some links there to the website that will also take you through some guides and videos on how to register. Is there any questions at the moment?
Struggling to find my audio button there. Sorry, no questions just now.
So we're now going to look at what you need to do in order to complete your DSPT. So we'll just take you through. So your answers are not public. It will only be what your status of your DSPT is. It's a self-assessment, and it will help you just to review like what policies and procedures you've got in place. There is different types of questions which we'll go through in a moment. You can use your answers and comment sections to record valuable information that will help you when you go to publish in the future. So this is what once you've logged in, what the social care view will look like. And we only need to answer the mandatory questions. So just looking through, if you click on the blue item, it will give you a bit more guidance and tips of what's required in a bit more detail and things like that. And there is support and resources if you need, you don't have all those policies in places. The toolkit is broken down into 4 headings. So as we mentioned before, there's 26 for approaching standards and 43 for the standards met. So under staff and roles, this looks at like the data protection, what cybersecurity training you've got in place, your staff who is responsible in your area for this. The policies will look at all the different data protection policies, staff contracts and things like that. And then where are we? So we've got, sorry, I'm just sort of think for a moment. The data security. So again, it's having good building and physical security in place. And this includes paper records and what to do in case of emergency as well. And then you've got the IT systems and devices, so having good practice in place. Small organisations, you might not be sure what to look, but the questions there will help you to look at your IT suppliers if you have some, and the questions you might ask them. Next slide. So looking at what the staff and roles will cover. So who has got responsibility in your area of work? The staff records and contracts. Do you know what staff they have? And around their contracts, do they understand about keeping data safe? When you come to the training for it, this will ask 4 questions about what staff training do they need, and this will depend on their role and what access they have. So you will need to look at a training needs analysis for that. So next slide. So we're just going to look through now at what's under the staff records. It's important to keep up-to-date records of both your staff and volunteers if you have them, and the roles that they have. The list should keep track of any change of role, new starters and removal of leavers. This might link to your existing payroll and rostering systems too. So we're just going to look at an example question here. So does your organisation have an up-to-date record of staff, volunteers if you have them, and their roles? And if we just move on to the next slide, it will just show. So going through here, it will just, like I said, you can click on the blue button, the blue text message, and that will give you more details of what's required. So this one is a tick box question, just need to tick that. But as mentioned before, it might be useful just to add a comment there when you come to complete it later, of information and where it might be stored. So as you can see here, yes, they have the information there, and it's in their HR folders, and there's both hard copies and electronic versions where they're saved. So an example for question 1.15, just going through here, and this is where they're asking you to actually write an answer. So you need to put some information in the box there. And the comments, again, this won't be on there, but it will be useful for colleagues in the future. It gives the best practice advice and it's what you need to do. And then it also, where the blue link is, will take you for further links for further help if you need it. So looking at the awareness training, have at least 95% of staff, directors and trustees and volunteers in your organisation completed training on data security and protection and cyber security in the last 12 months. So there's lots of resource out there. If you don't already have access to training at the moment, the Digital Care Hub website offers free e-learning course. It's easy accessible. Each module will only take 15 to 20 minutes and it's free for all staff. The other training that we do have available is for your data leads. So this might not necessarily be your manager, it might be a deputy manager or somebody else in your organisation. And there's training again available there. We also have a manager's discussion tool. So this will help you to evidence and understand your staff's learning from the training that they've completed. Sorry. The other question, so we're looking at the policies and procedures and the things that they cover. So you should and have already registered with the Information Commission office. It will look at what policies you have in place, what audits you do and spot checks, the national data opt-out, so that came in July 2022, about holding information and sharing information, retaining records and then disposing of the records and equipment too, and a list of all your suppliers. So if you haven't registered, you need to go to the ICO registration now. There is a small fee, but it is important just to highlight the importance of this because it could be a fine if you haven't done it. So what is your organisation? This question asks, what is your organisation commission officer number? So you just need to complete through there. So if you just go through to the next slide. So you do have an ICO certificate, it's on your wall and it'll ask for your registration number. And in the comments there, they've just put when they were registered and where the certificate is displayed. Going through, as we mentioned, there is lots of templates for policies available if needed. So you'll just see there some of the, for approaching standards, the information you do need. So how to document your data processing, including, this is where this takes sometimes a little time just to get together. So the information asset register and a record of processing activities. The teams are here to support if you need help with that, but there is templates available there. You've got your privacy notice template, data protection policies, record keeping, and so on for there. It may be that you have a policy that covers both two in one area, or you might, if you haven't, there is that resource. Then you see on the other side, for standards met, you'll also need your training needs analysis, the data security audit checklist, creating and testing a business continuity plan, and around the data opt-out. The other resource there is some recommended documentation as well if needed. So data security, what sort of questions are covered in this area? So we'll look at data breaches. What is a data breach? Do you have plans that what you should do if you do have a data breach? Physical security and paper records, and around your business continuity, what you'll do should something happen, and making sure that your staff are aware of that as well. So next question. The IT systems and devices. So these sort of look at your staff and your volunteers. So what access to information do people have? Around passwords, is it a strong password that you've got? Any backups? Like I say, in terms of the information, should something happen, how can staff, like if you're in home care, access information if it's needed? Around protecting your devices, looking at what protection you do need, the technical setup and support that might be needed, and what documentation should you be asking your suppliers from. There is a new mandatory question around the multi-factor authentication. So this is one of the most effective ways to protect data accounts from unauthorized access. You should consider all systems to have access on the internet, such as your email, digital social care records, and any cloud-based or online systems. So there is some information on the website should you need to know more about this question. So it's just a way to make sure your online accounts are much safer, and by adding these steps to prove that you really who it is yourself that's trying to log in. It's usually a text message, an email code, could be a fingerprint or something like that. You probably have already used this in the past when you do like your online banking or logging into social media. And it ensures we keep all information safe and allowing people to have access who need it. So the steps to take. So if you review all your current systems and speak with your suppliers, they may have the protocols and the systems already in place for that. Identify any potential issues, staff sharing devices or logins. Identify where implementing the multi-factor authority might not be appropriate, because if you put too many controls in place, people won't use it and they'll just go and find another workaround. And decide against your organisation around the balance of security and usability. What information that they're accessing? Not everything, will need that. And just note any systems about the MFA, it just needs to go to your director or your board level to say why. So I think I just mentioned previously, so not to go overboard, because adding too many layers, people will either stop using the system and they'll find a workaround. Identifying the appropriate level of security for each system based on what the information sensitivity is. Where appropriate, should the MFA be implemented for individual logins to systems? And there's support available from your local support organisation, software suppliers and IT suppliers too. So you'll find more further guidance on the Digital Care Hub around the staff and workforce, IT and software suppliers, documentation, retention and disposal, improving your security and mobile devices. So now we're just going to look at when it comes to publishing your DSPT. So if you're going to publish at Approaching Standards, you've completed the 26 questions there. The others may not be completed yet. You will then just also need to complete an action plan on how you might get there. Just to say as well, with the Approaching Standards, you can only publish that once. So publishing at standards met, you would have completed all 43 questions. And remembering it's your DSPT status that's published and not your answers. You'll see across there that you can see where they've been mandatory questions and completed. There is other questions on there you don't have to answer that are not mandatory. If you do know the answer, you can complete it there. And then, it's the blue publish bar at the bottom there, you'll just see. If there's a problem, you'll have an error page like this, just to say that, highlight that there's a problem there. If you click on the red links, that will take you back to the question and you'll be able to have a review of what information is required. So for the headquarter assessment, if you're doing for more than one site, it's as long as the sites have the same policies and procedures, IT systems and data security arrangements, you only need to complete the one assessment. If you click down on, you'll see the little where the arrows point in, you can view all the branches that you want to publish for. So it may be that you don't want to quite publish for all sites because one still needs to put something in place. You can just click for the ones that you do. So further support on publishing you can find on the website when we share the links with you here. And you then also have the local support partners as well. And for those larger organisations, the national team are there to support. So once published, if you can export your assessment to an Excel. If you click on the download button there, you can download to your device straight away. So just moving forward, sorry. It will ask here, so you can click and view details and save as a PDF. If you have published at standards met, you can also download a certificate there. And you can go through any previous publications as well. So just to save, it has Control P and save to PDF, or there's a little button at the bottom there as well. You'll see how to save there. Sorry. So once published, it's good to share your DSPT status. If you have a number of different sites, if you tell your branches and tell your registered managers that you've done this, download your certificate to prove. You might want to put it onto your website or in your office and things. Add it to your DSPT status on your website. Include it in your bids. Tell your commissioners, NHS partners and IT suppliers. And as we mentioned previously, for CQC, it's good evidence that you are showing that you've taken all the actions needed to safeguard information. So making it real, you can go into your DSPT at any time throughout the year. Things do change. You may have different changes into your policies or systems and things like that. So it's just easier to, if you go throughout the year and republish, but it is important to publish once a year. Ensure managers and staff understand what is expected of them and enables managers to access the information. You might want to consider to have printout of documents and related policies and procedures in a manual for your CQC. So next steps is around to have a review to see if you're already registered or on how to register. If you contact your local support partners through the link there, and you have got the national team as well that will support, check out the guidance on the Digital Care Hub, and it will take you through some of the questions. And it could be returned to it at any time, so you don't have to complete it all in one go. You can sort of go in and out, and it will automatically save your information. I think is there any questions that have come up?
No more questions.
Okay. Well, I hope you found that helpful. Like I say, do reach out to the teams for support and have a look on the website. Just before we go though, if you want to complete the poll just to see how you found this webinar. So what impact has this webinar had for your confidence to complete the DSPT? How likely is it that you're going to complete and publish your DSPT? And how likely is it you'll contact your local support organisation for help? So have we got the feedback? That's positive to see that it's increased your confidence. Some of you have said no impact, but hopefully we're just to let you know and remind you we're here to support if you need it. How likely, again, positive to see that 77% are very likely and 15% are likely to complete it too. So do reach out to the teams if needed. We're here to support, and thank you for attending today.
Amazing. Thanks so much, Cheryl.
Okay, thank you.